Welcome to our channel. Today we are going to talk about one of the most serious health conditions in the world, the heart attack. We'll uncover what it is, why it happens, what to do in an emergency, and finally, how doctors perform life-saving heart surgeries with modern technology. A heart attack begins when blood flow to the heart muscle is suddenly blocked. The heart is a powerful pump, working every second to keep us alive, and it depends on a constant supply of oxygen-rich blood. When an artery becomes blocked, part of the heart muscle begins to die, and that is a heart attack. But how does this blockage form? Over time, fatty deposits called plaque build up inside the arteries. When a piece of plaque ruptures, it triggers a clot that can completely block blood flow. Conditions like high blood pressure, high cholesterol, diabetes, obesity, smoking, and stress make this process even more dangerous. When a heart attack begins, the body often sends signals. The most common symptoms are heavy pressure in the chest, pain that spreads to the arm, neck, or jaw, shortness of breath, sweating, dizziness, nausea, and sudden weakness. If you or someone around you experiences these signs, call emergency help immediately. Do not wait. Every second counts.
If you or someone near you experiences these symptoms, the very first step is to call emergency medical help right away.
Now let's see how doctors save lives once the patient reaches the hospital. The most common procedure is called angioplasty with stent placement. In this surgery, doctors insert a thin tube called a catheter, usually from the wrist or groin, and carefully guide it through the blood vessels toward the heart. A special dye is injected to highlight the blocked artery. Once the blockage is located, a small balloon is inflated inside the artery, pressing the plaque against the wall. Then, a tiny metal mesh tube called a stent is expanded in place. The stent locks into the artery wall, keeping the passage open permanently. The balloon is removed, and blood flow is restored. This simple but powerful procedure saves millions of lives every year. In more severe cases, doctors may perform coronary artery bypass graft surgery, also known as CABG. In this operation, a healthy blood vessel is taken from another part of the body, such as the chest or leg. One end of this vessel is attached to the aorta, and the other end is connected below the blocked artery. This creates a new route for blood to bypass the blockage and reach the heart muscle. After the graft is connected, blood flows smoothly again, and the heart regains its strength. Both angioplasty and bypass surgery are life-saving techniques that give patients a second chance at life. But remember, prevention is always better than cure. Protect your heart by eating a balanced diet, exercising regularly, avoiding smoking, managing stress, and going for regular checkups. Your heart is the engine of your life,